Okay, I think we'll get started. I have turned on the recording, so that's also started. And just to let you know, one of our speakers does not have a camera, so Mara will be showing her nice picture on the side. But first of all, I'd like to welcome you all to the data collection webinar series for today. And we are very pleased that you're here with us. It is organized by the Data and Analytics section here at UNICEF headquarters. Today is the fourth webinar in the series that we started this spring. My name is Arnold, and I work with the data collection unit here at the Data and Analytics section. A couple of weeks ago on June 8th, we covered adolescent mental health. Some forthcoming webinars will include anemia testing, bullying, just to name a few. We are covering topics that have recently gained relevance or importance and where there is ongoing work on how best to collect data. A few housekeeping rules before we begin. We have scheduled about an hour and 15 minutes today, including the Q&A. As always, throughout the webinar, please kindly remain muted and write your questions in the chat box, and we'll do our best to group them and have the presenters respond to them during the Q&A session. The webinar is being recorded and will be available on our SharePoint site internally at UNICEF. Also with past webinars, it will also be available on the public site on the YouTube channel. You can find the links to both of these in the emails that you had received. So I think we'll get started. I'd like to introduce the chair of today's session, Chika Hayashi, who is the Senior Advisor Monitoring and Statistics and the Chief of the Nutrition Data Unit, Data and Analytics section here at UNICEF. A little bit about Chika first before I give her the floor. She has spent over 20 years at WHO, UNICEF, and the World Bank, and has developed numerous international monitoring and evaluation guidelines and global reports on health systems, maternal and child health, HIV, and nutrition. She is an epidemiologist and has scaled up new indicators and surveillance monitoring and evaluation systems across many countries. Chika, I'm going to hand it over to you to introduce the topic and the speakers for today's webinar.
Great, thank you. Hello, everyone. Good morning, good afternoon, good evening. Really, thank you so much for joining this webinar. We know you've all been really busy with busy schedules and really appreciate you making the time. So today's webinar is entitled Measuring, Collecting, and Validating Data on Child Food Insecurity. And we're very happy to have with us today 4 speakers. The first is Edward Frongillo. He is a professor and director of the Global Health Initiatives at the Arnold School of Public Health at the University of South Carolina. And some of you may know he's been recently awarded the Jean-Pierre Habit Lifetime Achievement in Global Nutrition Award at the American Society of Nutrition, which is an amazing achievement, and we're so happy to have him here with us. Our second speaker today is Elisabetta or Aurino. She is a development economist and is assistant professor of development economics at the University of Barcelona School of Economics. And then we have with us our third speaker, Hala, Ghattas, who is an associate research professor and director of the Center for Research on Population and Health from the American University of Beirut. And our fourth speaker is from UNICEF, Nyawo, who's currently the nutrition manager at UNICEF Zimbabwe, but as you all know, was formerly in ISARO. So we're very happy to have 4 different speakers from different regions, actually, of the world to really share their experiences on trying to collect information and data on child food insecurity. We do have the speaker's bio in the webinar flyer, so you can read more about them there, but I'd also like to ask all speakers to maybe briefly introduce yourselves before starting your own presentations, as you wish. I think that would be nice. And just one last comment on this webinar. I think this topic is very timely because, first, food security is an interest of everyone's, I think, and it garners a lot of media attention as well, and it does move a lot of funding from a policy perspective. But second, we've been really hearing about it a lot in the news these days from the impact of the Ukraine crisis. How the increases in food prices and fuel and fertilizer is worsening food insecurity and what we can do around that. And I think the question we want to ask ourselves is, how are children impacted by this? And what is the extent of food insecurity in children around the world? We've never really answered this question. And I think this webinar is sort of a first step to really see how we might be able to do that, to characterize food insecurity around the world in children. So we look forward to the presentations and all of your questions and answers to see how we can actually try to measure this in various locations. So Ed will start the presentation providing us with an overview of the topic and data collection in this area. And Elisabetta, Hala, and Mara will follow presenting recent experiences in data collection. So Ed, over to you. The floor is yours.
Okay, let's see here. Okay. So, hello everybody. So I've been working on issues related to food insecurity for about 40 years now, and the bulk of my work is focused on children. And so this has been a bringing together for me of my interest in children's welfare and in food insecurity. So what I'm going to do, I work with Chika quite a lot because I co-chair the technical expert advisory group on global nutrition monitoring. And through that effort and others previous have had experience, including working with UNICEF, about how do we devise means of collecting data and then get those into data systems, and so that's part of the perspective that we're going to bring today. So I'm going to talk about how we came to where we are with having a tool to measure child food insecurity experiences. And so I'll begin here with kind of an overview, qualitative research that started to get us to really think about how the concept of food insecurity applies to households and individuals and not just countries and globally. Started in the late 80s when Radimer did her work with colleagues, and then there was some other qualitative studies that were done in Quebec by Hamlin, and a replication study that we did published in 2003, and some work done in Burkina Faso and a few others. These were focused on adults and households. Carol Connell in Mississippi started interviewing children in 2005. I would say a little tentatively. She asked children about other children, not so much about themselves. But then starting about 12, 13, 14 years ago, we in South Carolina, Jennifer Bernal in Venezuela, and Hala Ghattas and her colleagues in Lebanon, started really talking with children in earnest to gain their voices about their experience. So that was the qualitative work that underpins this. In terms of quantitative assessment, the Radimer had developed a work, and there was another scale that had been developed in the US. Those were combined together in some sense to create the US Household Food Security Survey module, which was first fielded in 1995. The first application that I know of outside the US was UNICEF was doing a survey in Indonesia at the time of the economic crisis and political crisis in Indonesia. And so we helped them adapt something so they can include it in the survey. There's a Latin American and Caribbean scale that's been implemented in many countries in that region. The Household Food Insecurity Access Scale was developed to help assess the impact of interventions. And then FAO developed the Food Insecurity Experience Scale, which was first fielded in 2014 in the Gallup World Poll, which now gives us data on about 3/4 of the countries in the world annually and is part of the SDG tracking system. In terms of, so all of that is measuring adults and households. For measuring children's food insecurity experiences based on the work that was done in the US, Venezuela, and Lebanon, each of those three groups developed a way of measuring in a questionnaire children's experiences directly. And though that work underpinned then the work that we've completed recently to develop the Child Food Insecurity Experiences Scale. So why is this important? Well, from the very beginning, when we started being able to collect data from questionnaires and surveys on food insecurity reported by adults about households, we found that there were really strong associations with poor outcomes in children across a wide spectrum of possible outcomes: behavior, health, social and academic, development, hospitalizations, diet, physical activity, linear growth, obesity, and others. All were affected by food insecurity. We learned that food insecurity affects well-being through a nutritional path, through diet and nutritional status, but food insecurity is also a profound stressor, and so it affects children through non-nutritional paths by causing physical hunger and how that feels, distress, by having adverse family and social interactions, worry and anxiety, and feelings of deprivation and alienation. And all of these in households, among adults and among children, have a profound effects on children. The qualitative work that was done with children is from ages 5 up to 17 or 18, showed that children are aware of food insecurity and take responsibility for it. So they're cognitively aware, they know about food scarcity and what that means in their family. They have emotional experiences as part of this, feelings such as worry, sadness, and anger. There's physical feelings, including hunger, but also pain, tiredness, and weakness. And then they take responsibility by going along with adult strategies, by initiating their own strategies to stretch resources, and especially if they're in adolescence, taking actions to obtain additional food or money for buying food. So then why might we then need to do direct assessment with children to learn about their experiences from them? First of all, we've learned that parents are not fully knowledgeable about children's food insecurity experiences, both because of a lack of communication among them and because of efforts to protect each other. We've found that parents try to protect their children, parents are trying to protect each other, children are trying to protect their parents, and older children try to protect their siblings. And all of this means that adults do not know fully what's happening with their children in this regard. And then this has shown up in many studies now where there's poor agreement between reports by adults and reports by children and adolescents. And so finally, the work that's been done in those 3 countries that I mentioned shows that children of these ages from 5 or 6 up to 17 can accurately assess their own food insecurity experiences, whereas parents are inaccurate in that. And the data on that are pretty clear. So this motivated us with support from Chika to develop a questionnaire that could be used globally. And so we took the 3 questionnaires from the 3 countries in mid-2019, before the pandemic emerged, selected a parsimonious set of items, refined the wording. They were translated into Spanish and French. Some cognitive interviewing was done by the International Food Policy Study. And ultimately, we implemented this questionnaire that was developed in 15 surveys in 13 countries to almost 19,000 children and adolescents between ages 5 and 18. So the International Food Policy Study was implemented in 6 countries, in 4 English-speaking countries and 2 Spanish-speaking countries. The International Food Policy Research Institute did a study in Accra, Ghana. Had to stop their study because of the pandemic, but we have the data from before then. Hala and Zaina Jamaluddin, who's on the call, in Lebanon, collected data in early 2020. Betta and her colleague Sharon Wolf collected data in northern Ghana. In the middle of the pandemic in 2021, there's 2 surveys there for younger and then older children. And then Mara and colleagues collected data. We have data from 5 African countries also collected in 2021. So this is the questionnaire that was developed. It says, okay, we're going to ask you some questions about food. For each question, please answer whether it happened many times, 1 or 2 times, or never in the past 12 months. 12 months has been the sort of standard reference period for food insecurity assessment, not the only one, but the most common one. And so then there's a series of questions. In the last 12 months, did you worry that food at home would run out before your family was able to get more, etc.? And I'll show in the next slide, we'll go through the questions a little bit more carefully there, but this is the experiences scale altogether. So just to give an idea of how this compares to the FAO measure, for example, I'm showing subconstructs on the left and the FAO measure that's asked of adults 15 and above in the Gallup World Poll, and then the food insecurity, child food insecurity experiences scale is on the right. So you can see that both of them have a question about asking about worry about food at home running out. And the child measure has an additional question about worry. Are children worrying about what's happening with their parents because of trying to get enough food? And then for diet quality, there's a similar question about not being able to get the right foods because there isn't enough money. And then for skipping meal, it's almost the same question, very similar question about skipping a meal, and then either eating less than you thought you should, or in the child measure, it's cutting the size of your meal. About going hungry, there's a question that's almost the same about, were you hungry? But then in our scale, we ask also about children feeling tired or weak because the family didn't have enough food to eat. And then finally, there's no questions in any of the adult or household measures about emotional awareness. But this is so important for assessing children's food insecurity experiences that we have 3 items there asking about embarrassment or shame because the family didn't get enough food, feeling sad or mad because the family didn't have enough food, and then feeling embarrassed or ashamed about what your family had to do to get enough food. So those are the 10 items. They're scored this way: too many is many times is 2, 1 or 2 times is 1, and never is 0. So when you add that up, it goes from 0 to 20. We've created 4 ordinal categories from the number of experiences based on what we know about what these experiences mean, but also it was developed in part by looking at how this relates to some other variables and where we see inflection points. And then we've proposed that the prevalence of several or many, in other words, 7 or more experiences, be used for population assessment, monitoring, and tracking. Excuse me. So in the work that we've done with the data that were collected, we used classical measurement theory and factor analysis and showed that the variability explained by one factor ranged from about 92% to over 99% of the variability explained by one factor, which suggests strongly that the scale hangs together as one scale. The scale reliabilities are also high, 0.88 up to 0.94. And we also did an analysis to compare across the surveys, across the context, using what's called the alignment method, which gets at approximate equivalence, and found that about 17% of the thresholds, in other words, moving from one point to another point, in the loadings, the factor loadings, were non-equivalent. The guideline is that it should be less than 25%. So it's well below that. So that's quite strong evidence for cross-context equivalence. And you can see the idea here in this graph. There's 3 clusters of countries here from the 15 surveys we have. The international food policy studies, which are the better off countries, are in the bottom on the darker solid line. And the middle one is Ghana and Lebanon. And then the countries in which UNICEF collected data in Africa are poorer countries with higher experiences of food insecurity. And so those are at the top. And the main thing is you can see that the pattern across the items, it's the items going across the bottom there. The pattern across the items is very similar for all 3 clusters of countries, suggesting that it behaves similarly across these contexts. And then to assess criterion validity or accuracy, if you prefer, we looked at associations with other variables to see whether the associations were as expected. And pulling from the different surveys and the data that were available, we compared against families not having enough money, about the child eating breakfast, child eating dinner with caregivers, measures of household food insecurity, toilet facilities, ownership of home and rooms in home, so measures of sort of the wealth assets, household head employment, mother schooling, wealth index, child diet diversity, self-esteem, and motivation. And for all of these, we saw associations in the expected direction. So this suggests that we have evidence for accuracy for differentiating groups of children. The previous work that was done has shown strong evidence of accuracy for differentiating individual children, but we weren't able to do that in this study. So in terms of then thinking about global assessment for child food insecurity, up until now, we've been able to assess the prevalence of food insecurity in households with children, but that's not the same as assessing the food insecurity of the children themselves. We can't assess the prevalence of children's experiences of food insecurity except in the food insecurity experiences scale on the Gallup World Poll. We do have data from children, adolescents 15 and up, but not for younger children. And WHO coordinates the global school-based health surveys for children ostensibly 11 and up, although most of the surveys don't have children quite that young, but that's only one item about hunger, so it's not a full scale. So that's limited, useful, but limited information. The other aspect of this is that not all the experiences of food insecurity about children are being assessed. So lack of choice and the need to make compromises, which is what results in feelings of deprivation and discouragement, are not assessed in any of the existing measures. Access to getting access to food in socially unacceptable ways or having socially non-normative patterns of eating, which leads to shame and guilt, haven't been assessed either. So the questionnaire that we've developed fills that gap by having items that get at both feelings of deprivation and shame and guilt. So what we're proposing here is that we now have a questionnaire that we've demonstrated has validity and cross-context equivalence and can be used in countries globally. And so really the challenge going forward is how do we put these into data systems? So for example, the multiple indicator cluster surveys has started a module for 5 to 17-year-olds. Is that a possible data system in which it could be included? And what are other data systems? What are other means in which this could happen? What we found with previous efforts to assess food insecurity among households as adults is that once the questionnaire was available and people had confidence in it, then it started to being able to be incorporated into multiple data systems. And as you'll hear from my colleagues to follow here, once we started asking around about opportunities to test out the questionnaire, there are a number of people who readily were able to incorporate it in their surveys. So we think that there will be ways of having data being collected from countries. The challenge will be how to do that on a systematic and regular basis. So I've included here some references. The one that's highlighted in red is the article that's just been accepted. It's now posted in its unformatted version, but it's available for you to read through to sort of get the details on what I've talked about today, and then some of the other articles that sort of buttress this work. So I'll stop there and turn it back to Chika.
Thanks very much, Ed, for that excellent overview. If anybody has any questions, just a reminder, please do type up your questions in the chat and we'll have them answered at the end. Now over to Beta for her to share her experience in collecting this data in Ghana.
Sure. Hi. Sorry, I just... So thank you so much, Chika and the team at UNICEF for inviting us to present our experience with the collection of this child food security data. So my name is Elisabetta Aurino. I'm a development economist based in Barcelona in Spain. I've been working in the field of food security also for 10 years now. I started with measurement of food insecurity during my PhD, and then after that I kind of moved more towards the understanding what are the consequences of food insecurity and malnutrition on children's trajectories over the life course in terms of education, health, and social emotional development. And I worked also a lot in terms of food assistance, and especially in terms of school meals and their effects on child development in different settings in low and middle income countries. So today I'll just share some insights of applying the tool that Edward has just presented. This is joint work that I've been doing in northern Ghana with my colleague Sharon Wolf, who is a psychologist at the University of Pennsylvania. And then I really would like to emphasize the role of our partner organization in Ghana, Innovation for Poverty Action, and especially the role of Richard Murphy, that was our fieldwork lead in this study, and Edward Smigo, that is our the research manager, and all the field workers that really made possible this data collection, and you will see why in a moment. So just to say a word about the context for this study. So we started to work in these northern Ghana regions during the pandemic as schools were still closed, and then our evaluation moved as school reopened. So 5 regions in northern Ghana. This is really the poorest part of Ghana. So this is a map that shows income poverty levels. And you can really see that these darker areas show higher prevalences of income poverty. So it's really the most deprived economic setting in the country. And also human development levels are low. So we have, for instance, high rates of child stunting for children under 5. And this map, this chart shows you the proportion of children that reach some developmental milestones at age 5. And you can see here that the regions in which we work are really kind of lagging behind other areas of Ghana. So this is a typical community in which we work. So it's mostly savanna or quite arid areas, and most of the population is involved in subsistence agriculture. So this data collection exercise was part of a broader impact evaluation of a digital intervention that we developed in order to support parents to engage with their children education as children were at home during the school closures, and as school reopened, to kind of motivate them to go back to school. We work with around 2,600 households. These were enrolled through phone calls based on the Ghana panel study and other samples that were already ongoing. And something that is quite nice, especially if we think about the measurement of food insecurity, is that we randomly sampled 2 kids if they were available in the sample from different age groups. So 5 to 9 and 10 to 17. And this was originally because we thought that intervention could work differently based on the age of the kids. So we have a sample of around less of 5,000 children. So we started a baseline with a phone-based enrollment call towards the end of 2020. And then we moved to in-person data collection for midline and endline. And if I have time during the Q&A, I can talk why we decided to move to in-person data collection, although at the beginning of the study, we thought to do everything remotely. I will focus also on these in-person rounds of data collection, because this is where we collected the child food insecurity measurements. So we administered this survey that was developed by Ed and his colleagues in our sample. And in terms of findings, we found that around 3/4 of the children in our sample has had any experience of food insecurity. There was also some variation between midline and endline. So we find some slight increases in the endline because it was probably the harvest season and schools were closed, so the school meals program was discontinued. and also all slightly higher prevalences among the older children, so 10 to 17 compared to the 5 to 9-year-olds group. And this is, if we kind of split our food insecurity measure based on these categories that Edward has mentioned earlier, so no experiences, fewer experiences, several, and many, we see that kids in the younger age groups are more likely to fall within the no experience or fewer experiences, while the adolescents are more likely to experience more food insecurity. And this may be probably due to this buffering that happen between parents and children, or between older siblings that tend to kind of buffer younger kids, or maybe reporting differences as well. We also collected the household data on food insecurity, so the FAO FIES indicator that was also mentioned earlier. And we can see that the correlation, there is a correlation of 0.36 around the 2 rounds of data collection between our child food insecurity and the household food insecurity measure. But you can still see that although there is a moderate correlation, this is not perfect. So the two measures are really capturing different types of experiences. So in terms of challenges to in-person data collection, one of the main challenges that our field workers had to face was that there was really lack of resources and privacy for conducting these child assessments. Not only we also collected other data related to literacy, numeracy, social emotional skills beyond food insecurity. And so it was really hard, given the context, to find a place in the household where kids could focus on the assessment. And so our field workers were really smart and flexible, and they really organized to find other solutions in order to reduce the impact of this lack of space and privacy to conduct the assessment, and to also preserve data quality. Another issue that we faced was the tracking of parents and children. So this was a longitudinal study, so it was really important to preserve the sample over time. And but we worked during the Ramadan period in the midline, and then during the harvesting period at the end line. There were a lot of floodings also, so this climate change related issues that occurred, and also the COVID crisis also intensified the migration. So it was really key to kind of track both parents and children. And so there were different solutions that were sought to kind of preserve the sample and track participants. For instance, really reaching parents and children in the places where they were staying most of the time. So there are fields or after schools in other community centers. Also scheduling data collection based on their needs, and rescheduling appointments. So calling back and say, are you gonna be there? Do you want to change the timing of the appointment, and so on, and postponing data collection in inaccessible areas for the safety of data collectors. So in terms of, and actually this very flexible approach worked really well, because we have amazing attrition rates despite all of these challenges. So we only lost 3.4% of the initial sample, so very good tracking rates. In terms of child food insecurity data, so usually enumerators, when they're trained, they kind of need to remain neutral, no? When they ask even sensitive questions. But since the child food insecurity module could lead to some distress, or children recalling situations that were not pleasant for them, so they were trained really to take these issues into consideration, especially because we are working with a very vulnerable population of children in low-income settings, and to empathize or support the kids if they felt distress, or even stop the data collection at any point if the child would require so. So they found that generally children were okay and quite honest in providing the responses, although we had some issues in which some children, by recalling some situations that were related to food insecurity, started to cry. And this was mostly with the kids that were more in situation, they were not with their parents, or they were maybe staying with relatives. So maybe these are kids that going forward we should think about how the data collection could be maybe modified or to support them, or to address their situation. And also there were some recalling period, especially for the younger ones, so 5 to 6 years old. They had some challenges in really thinking about what was the situation in terms of food insecurity of their situation maybe in the past 12 months. So these are my contacts in case you want to ask me some questions after these seminars. And this is some references. So this is the paper that Edward mentioned earlier. This is the broader project website. And also we wrote a blog about our challenges to remote data collection, which maybe could be useful for this group. So thank you so much, and looking forward to the other presentations.
Wonderful. Thank you so much, Beta. Let's have Hala get set up to share the experience around Lebanon. But again, Beta, thank you so much for helping us understand the context that you're working in, and also to raise, issues around children maybe not being home, the older children, and trying to find them, and what, sort of think about what is the best way to try to make data collection easier for us and them. But we can talk about it more during the Q&A. So over to you, Hala.
Thank you so much. So my name is Hala Ghattas. I've been based at the American University of Beirut since around 2009. And I've largely worked on, similarly to Beta, measurement of food insecurity, and focusing specifically in our context on marginalized subpopulations, which for us have largely been refugee subpopulations, Palestinians and Syrians. I'm going to be presenting some lessons learned from applying the scale that Ed described in some school-based surveys in Lebanon. So the study I'm largely going to be pulling out lessons learned from, it was an evaluation study of a WFP emergency school feeding program, which was conducted just before COVID, and we actually had to stop data collection a little bit short of our target sample size because of school closures as a result of COVID. We implemented the study in Lebanese public schools and included Lebanese and Syrian refugee children. In Lebanese public schools, we have had some adaptations to be able to provide services, educational services for Syrian refugees, which means that there is an additional school session in the afternoon, which is largely made up of Syrian refugees. And in this context, so this was 2019-2020, there was a school feeding, an emergency school feeding program, which was being implemented by the World Food Programme in specific schools. And what we did was we matched intervention schools with control schools to actually evaluate the potential impact of the WFP emergency school feeding program. So this study looked at children aged 9 to 14, and it was included 10 control schools and 10 intervention schools, which were matched on various characteristics. And our sample size here was just under 1,600, of which about half were Syrian refugees. We've also more recently been implementing the Child Food Insecurity Experiences scale in a cross-sectional survey. So during COVID or post-COVID, when schools reopened, in both public and private schools in Greater Beirut. And these data we've just completed data collection. So I won't be showing data from here, but I have extracted some lessons from this study as well. So both of these studies use school-based cross-sectional surveys, and in terms of being able to move forward with that data collection approach, we had approvals from the Ministry of Education and Higher Education in Lebanon. We then approached school directors and sought approval from them to conduct the study in their schools. Then consent was sought from parents by sending consent forms home with the children for parents to sign, written consent. And then we sought assent from children to participate in the studies. And then the children who provided assent participated in a face-to-face CAPI, so a computer-assisted personal interview in the schools. And we collected data using Kobo Toolbox on tablets. And this is just to show one of the studies sort of where the child food and food security module was embedded sort of within other, if you like, surrounded by modules that were focusing specifically on nutrition. And so it was sort of embedded in the middle, in between those. So in terms of trying to find private spaces, for us working in the schools, we were able to try to allocate spaces, sometimes in external spaces in the school, sometimes in rooms in the school, where we were able to have that privacy that Betta was talking about, that was difficult to get in households. We tried to match the gender of data collectors to the children where possible, to reduce any discomfort that kids may have. And we also, found some of these questions to be particularly sensitive. And so we did give the children the option not to answer any questions that they did not wish to answer, and also to withdraw from the study at any time. And so this is just a snapshot of some of the data. So Ed had presented some of the criterion validity or criterion associations between criterion variables and the child food insecurity experiences. This is just to show that the child food insecurity experiences scale was actually sensitive in our context to both refugee status, but also to the intervention itself. So these are data showing the proportion of children that report having several or many experiences of food insecurity. So in our sample, we had about the majority of children actually reported few, about 44% across Lebanese and Syrians. And this is again, just before COVID and at the beginning of the Lebanese economic crisis. Things are getting quite a lot worse over time at the moment. But just to show on the left, the two bars on the left are the Lebanese children. So this is the proportion of children that report several or many experiences. And in our context, the intervention didn't really show a difference. There wasn't an association with intervention status and child food insecurity in the Lebanese children. But if you look on the right, these are the Syrian children, and Syrian children in control schools experienced higher levels of several or many experiences of food insecurity than children who had received the school feeding intervention. And so the child food insecurity experience scale was able to differentiate between, if you like, prevalence across sort of Lebanese host communities versus Syrian refugees, but also it was sensitive to the school feeding intervention in refugee communities. So in terms of data collection experience, we found that the tool itself, sorry, I've just lost my screen. I can't see my slides anymore. Sorry, I'll stop sharing. Yeah, but I can't. I'll try doing this again. Sorry about that. Okay, so we found that it was relatively quick and straightforward to implement as a module. It was quite easy to integrate and standardize in a CAPI survey. And as I said, we embedded it before and after other nutrition modules. We were able to collect data from children in private spaces free of external influences. And in our context, this is in reference to something that Betta said, where children were actually, if you like, disturbed by the questionnaire. We actually have been in more recent surveys integrating a real-time calculation of the food security score. And when we're working, particularly when working with implementing agencies who have programs that children could be referred to. We've been doing this in household surveys and now more recently in child surveys, integrate a referral mechanism into this so that in the survey, in the CAPI survey, there's a calculation of the CFIES score. And then if they are found to experience food insecurity, then we could refer them to services that are available by NGOs or other implementing agencies within their context that they would be eligible to receive. So forms could be sent home for parents to try to get in touch with NGOs who could be providing support for these families. In terms of disadvantages, we did have in the more recent survey, particularly after COVID, despite a lot of infection prevention and control protocols being built into the data collection, quite a lot of refusals at school level, with directors not wanting data collection teams coming into schools. In our training, we had data collectors express concern, particularly around the questions on shame and embarrassment. And quite a lot of children were potentially, it sort of triggered some emotional distress in some of the children. And of course, school-based CAPI required schools to be open. So with our second study, we had to wait for schools to reopen and for things to normalize before we were able to implement the survey. And these are just references to some of the studies that that Ed was referring to that we've done in the context of Lebanon. Thank you very much.
Thank you very much, Hera, for another interesting presentation. Let's have Mara set up. But it was great to hear about Lebanon and Syria, including in the refugee population, and the way you were able to sort that. Well, at least from the slide you show, that you actually were able to see a difference between the refugee population and the host population, but also intervention and non-intervention. Right. Okay, over to you, Mara.
Okay, so thank you very much, Archana, and thank you to everybody. Just for a quick introduction to myself, I'm now the nutrition manager for UNICEF in Zimbabwe country office. And I was previously a nutrition specialist in the Eastern and Southern Africa regional office, covering a portfolio of data and surveillance and knowledge management. So today I'm going to talk about some data collection that we did while I was at the regional office. And I just have a few slides to talk about that experience from the Eastern and Southern Africa regional office, where we collected data using the Child Food Insecurity Experience Scale through telephone interviews and telephone polls. And I'll just go a bit through the background to our work, summarize the method that we used, and just show some of the results around the CFIES, and just discuss some of the challenges and the next steps. So yeah, just as a bit of background to the work that we did, in late 2020, in the Eastern and Southern Africa regional office, we started some research in 6 countries in the region to assess the impact of COVID-19 on child, adolescent, and women's diets and eating practices, and also on nutrition service uptake and continuity. We started off with a desk review of available data and information, and then in mid-2021, we moved to primary data collection through remote means using computer-assisted telephone interviews, or CATI, which were run by Geopol for us. And as well as that, we did some telephone polls that were run through UReport. So we collected this data from the 6 countries that are listed there. In the end, we had more than 57,000 respondents in total between the CATI, the computer-assisted telephone interviews, and the UReport, with a lot more UReport respondents overall compared to CATI respondents. We were aiming for a minimum sample size of at least 2,000 respondents per country through the CATI, and that was an overall sample size split between the various different respondent groups that we targeted for the study, and we achieved that sample size. And then through the UReport, we aimed for as many respondents as we could get, and the final number through UReport varied by country, depending on the uptaking country and the length of the time that the poll was run for, country by country. Next slide, thanks, Archana. So just to summarize a little bit the methods briefly, as I said, this survey was designed to use remote data collection because at the time of the difficulties with household data collection during COVID-19. We asked a range of questions around foods eaten and change in eating habits due to COVID-19. And we also asked their adult food insecurity experience scale and included the child food insecurity experience scale as part of the testing, as Professor Frongillo has already explained. We were limited a little bit by the number of questions that it's possible to ask over phone surveys and also the number that can be sent via U-Report. But we managed to include all the 10 questions for the CATI through the telephone interviews. And for the U-Report, we prioritized five of the questions. And we picked those 5 in consultation with Professor Frongillo and his team. In the end, for the CATI, we reached over 1,300 complete responses for adolescents aged 15 to 19. And that was out of a possible number of 2,852 altogether. And so we did experience some refusals and some preferences not to answer some of the questions, some of the 10 questions. I think, as others have already described, some of them might be quite difficult to answer. The U-Report targeted children aged 10 to 19 years, though overall, in the end, 95% of the respondents through U-Report were in the age category of 15 to 19 years. We reached over 4,100 complete set of responses through the U-Report out of a possible of more than 11,000 responses in this age group. Again, many missing responses to some of the questions, so some answered, but not all of them. Moving on to the next slide. This slide just summarizes the results that we found. And it shows the aggregated results across the 6 countries, though of course there were differences by country. And overall, about 90% of adolescents reported experiencing food insecurity. That was either many inexperience or some experiences, so both together. And many experiences of food insecurity were reported more often through U-Report, which is the many experiences is the grey part of the circle. We also asked the standard adult food insecurity experience scale questions to adults. And although the 2 scales, as we've heard, are not directly comparable, and that's because the child food insecurity experience scale uses a different set of questions, overall, children did report higher food insecurity experiences than adults in our survey. Although adults' food insecurity experiences were also fairly high, and I've just listed the proportions there, and that's both moderate and severe food insecurity that are shown there in those proportions. Moving on to the next slide, I'll just go through some of the challenges that we experienced while we were collecting this data. And maybe first of all, to start off with the bias of collecting data through telephone surveys. We hadn't had any previous experience of carrying out telephone surveys in this region. This was the first time that we'd carried out this type of data collection. But we did see overall across the results that we did see the reflection of only reaching those respondents who own telephones and obviously are willing to respond to the survey. There was a high proportion of non-response overall. And we saw quite a lot of bias in the data that we collected by phone when we were able to compare it to existing household survey data, including bias towards better educated respondents. And overall, our sample did include a higher proportion of better educated respondents compared to household surveys. And as I said, we also had a large non-responder bias across all the questions and all the 6 countries that were included. And it wasn't only limited to the food insecurity experience questions. There were quite high levels of non-response overall. This is usually expected with telephone surveys, but it does raise the question of how we should maybe control for it from the design stage going forward. We also found that it was hard to reach adolescents. Meeting the target numbers that we had per country was difficult. We didn't have existing telephone lists that included adolescents. So GeoPol did a lot of random digit dialing, but also recruitment of respondents through Facebook. Around the area of consent, which has also been mentioned in the previous presentations, we didn't have any experience to use on how to collect informed consent from adolescents. And we thought it would have been useful, or going forward, it will be useful to have a standard system in place for this. And it could also be useful to have a focal point in UNICEF for data collection from children and adolescents. For our survey through the CATI, we first asked permission of the mother or the caretaker to be able to talk to the adolescent in the household. And then we asked again permission from the adolescent themselves to respond to the questions. And also, of course, gave them the option that they could stop at any time, or they didn't have to respond to any of the questions that they didn't feel comfortable with. With regard to the kind of privacy as well, that's already been mentioned, and the ability to respond freely, it was really not possible to know through the phone surveys if children were responding freely or not, or if they had their parents around and listening, or if other people were listening as well. Refusal to answer the survey. This included refusal to individual questions that the children and adolescents didn't want to respond to, as well as the refusal to respond to the module overall. And as I showed, we did have a high proportion of refusals around this. And then on reaching the full age range of all eligible children, we could reach adolescents directly, of course, only if they had phones. But for this survey, anyway, as I said, we had to ask a parent for informed consent. So even if we did get directly to an adolescent, we had to ask them to pass the phone to their parent or caretaker to give us permission to carry on with the survey, and then from the respondent themselves, the adolescent themselves. U-Report did include some younger respondents, but mostly respondents were older, in the age group 15 to 19. If you click again, it just brings up some of the next steps that I'd like to talk about. Yeah. So this is also in relation to overall collecting data through telephone surveys, at least in this region. Yeah, the experience of this data collection led us to ask some questions as to whether we should be introducing methods to kind of debias the data from the design stage. Collecting some basic information on respondents, particularly around what geographical area they come from, and probably their education status. And we're doing some further research into the data with CDC at the moment to see if weighting the responses by, for instance, geographic location in the country, by education status, will make a difference to the results. And that includes the food insecurity data, both the child and the adult food insecurity data that we collected, to see if we weight the responses, does it make a difference to the results that we got? Just quickly to summarize some areas where we think we probably could do better next time if we're going to collect remote data again. It would be, first of all, to collect some more systematic feedback from the service provider, who in this case was Geopol, and have a better way of collecting their feedback on how it was to administer the questions, so that we can understand better what worked, what didn't work, and what the problems were. As I've said, we had limited information on respondents. As I've said, some of the recruitment was done through Facebook or random digit dialing, so we didn't know in every case where they came from, geographically speaking, in the country. And we also think we need to develop a feedback loop for sharing the data and information that we collected back to respondents. So we would need a mechanism developed for this. So I think that was my last slide. I've just included at the end as well some references on overall data collection via telephone surveys. And thank you, and back to you, Chika.
Thank you very much, Mara, and to all the presenters for your interesting presentations and for sharing your insights of your data collection efforts. So I think now we're moving into the Q&A. I see a couple of questions, including one that I mentioned myself, so we can answer these two specific ones. I also noticed sort of a few themes coming up from across their presentations. One around sort of finding children and what is the best way to contact them if you're going to households and they're at school. do you organize your schedule so that you go after school or make appointments with them and set up times on weekends? So I think there was one sort of area there. I think there was one around the private space and, you know, what is needed and what's that best environment to ask some of these questions. And then I think it'd be nice to hear a little bit more about telephone, the caddy, the U report. Mara, I wasn't sure if the U report was a text U report, but that's again different as well versus face-to-face. And I wanted to also see if Attila and other mixed colleagues, I think I saw a couple of you on here, you know, had some questions. We do have this excellent opportunity with the actual data collectors from different settings. And if you had any specific questions to them, also vis-a-vis some of the other data collection seminars that may have been held where people may have sort of raised issues and difficulties, if there's anything you'd like to hear from them, I think it'd be nice for the mixed colleagues to ask any questions. So I see Attila wrote something here. Let me start with, let's start with this question from Arij on what are some of the beneficiaries' personal data protection measures you took? Were there any issues with data protection? Maybe we can ask everybody here, the 4 presenters. Well, I'm not sure, Ed, maybe you can speak in general, even about some experiences from the US. But can we maybe start, I'm just sort of looking at who's on my screen, but can I start with Beta and then go to Hala and then go to Ed and Mara?
Sure, yeah, that's a great point. So we worked according to the data protection regulation set by the European GDPR. So basically we followed all the protocols really to support the effective data protection measures. For instance, the data that we use for analysis were not identifiable. We didn't know, we only had a code related to the household and the child. So we as researchers could not access any kind of personal type of data. These are all stored in our partner organization and they're kind of in a encrypted, password protected storage. And I think even the data collection team need to go through different kind of steps in order to get to this personal data. So we follow all the protocols really, the standard ones.
Thank you, Beta. Over to you, Hala.
Yes, I mean, we also do very similar we follow similar data protection policies. We abide by US federal, so our institutional review board at the American University of Beirut follows US federal regulations around data protection. So for us, I mean, the main things, just thinking about CAPI, that we think adds, if you like, to some of the protections is that as soon as a survey is completed, it is submitted online and it doesn't remain on the tablet. So in fact, it becomes it goes onto the secure server, or everything is password protected, and then clearly everything is de-identified. So names are not retained within the data sets at all. With our study, it wasn't longitudinal, so we didn't need to collect names at all. So we didn't even have the names to start with. And so many of the personal identifiers were just not there, with schools in our case being coded with IDs as well.
Great. Thank you, Hal. You know, I see we only have 9 minutes left, so instead of going around and asking everyone to answer the same question on data protection measures, I hope Arij, that gave you some sort of idea on obviously efforts to de-identify things, and we can always ask more follow-up questions and see sort of whether there is a standard guidance and whether what we have is enough or not enough. Can I maybe move over to Mara, because there are specific questions to Mara. So Mara, one of the questions is for me. You said that, you know, sometimes people didn't answer. I mean, actually everyone can probably answer this too, but some people didn't answer all 10 or all 5 in your case. I was just wondering if there are certain questions that were that tended not to be measured because, and maybe, I don't know if you did cognitive interviews on why they were hard to understand or just more difficult questions to answer. So that's one question. And then Attila had a question to you on whether you can expand a bit on the research with CDC to sort of explore further some of these issues, and then also the weighting that you mentioned. So over to you, Mara.
Yeah, thanks, Chika. So in terms of which questions were answered or not, we do have that information, but we actually haven't analysed it at the moment. There's a lot of information we had from these telephone surveys that we can do a lot more with, but I agree it would be very interesting and to look at more closely going forward. So yeah, we do have that data, and we can do that additional we can do that additional analysis together with you and you all. That would be great. In terms of the research that we're doing with CDC, like I said, we saw biases across all the data we collected, and some of it we compared to household level data. For the food insecurity data, both the adult and the child, we didn't have anything to compare it to before, so it's difficult to know where we are. But for some, like for instance, especially around breastfeeding, exclusive breastfeeding, and diet diversity, we saw big differences in comparison to how data collected through household surveys. So that's what prompted us then to start looking more closely at our data to try and understand why and what are the biases that we're seeing. And like I said, we looked at the education level in particular, and we saw that our respondents had a much overall much higher level of education. So the work that we're doing with CDC is to specifically to look at more of those biases, but especially around the response rate, because as I've said, the response rate was very low. Like that, there was probably up to about 60% non-response to the phone calls. To see if weighting by region will make any difference, and then of course weighting by education level. In comparison to baseline surveys, but they're also going to look, as I said, at the food insecurity data, both adult and child, to see if applying those weights would make a difference to the results that we got. Yeah, so that's in a nutshell. But I think overall we saw that we should have collected, or we could have collected much more kind of systematic feedback from the service provider, from GeoPol, especially around why children didn't want to answer the questions, or what was difficult about asking them and answering them for children. Thank you.
Great, thank you, Mara. And then Hala also added in the chat some of the questions that were less sort of answered in her setting. So maybe Ed, we can ask a question to you from Vrinda, which is, could you please share a bit more on the indicators that inform the cutoff categories for the scale? I think the four scales. And then just to everyone, I'm gonna just to queue up the next question. There's a question from Lauren on gender, so we'll have everyone maybe answer to that, but maybe over to you, Ed, first.
Yeah, I mean, Vrinda, it was based on a combination of looking at the distribution and thinking about, for example, I think the most important cut point was the one at 7 or above. And I think our reasoning was that, 6 is in essence saying that you've had 3 experiences that occur fairly often. And, we just thought that going beyond that is a pretty strong indication of more severe food insecurity. So it was partly that, and then partly just when we looked at the relationship, when we were doing the criterion validity analysis and looking at all of the different measures, just trying to get a sense of when is it, especially for the ones that were really, I think, specific to children, like the ones that Beta collected, and some others about eating breakfast, that where is it that you saw a jump up in the relationship. So it was trying to integrate information all together. There's a certain amount of arbitrariness in it. I can just start about the gender question. I think the gender question is really important. For the analysis that I was leading, that we've talked about, the emphasis, the priority there was the behavior of the scale itself, and the scale behaves in the same way for males versus females and across the different ages. But I think the question that was being asked about, okay, is what about, that Lauren is asking, is what about gender? And yeah, I certainly encourage all of us to be using the data we have to look at that. From data that we've had previously, girls, especially adolescent girls, tend to have, at least in some places, have higher prevalence of food insecurity, and tend to be more responsive to interventions about food insecurity. But that's just been in 1 or 2 places. So there's a lot to be learned by using this information.
Great, thank you, Ed. Maybe can we go to Beta, Hala, and then Nora on the gender topic?
Sure. In Ghana, even if this is quite a deprived region, and we collect other gender biases indicators, and there is pro-boy bias for education or other areas, we didn't find any difference in the reporting of food insecurity between boys and girls. And also when I check by adolescent groups, I don't find differences there. The only small difference that I find is between boys and girls in the younger age bracket, 5 to 9, where actually girls are doing actually slightly better than boys, but very small. So we don't find that there, which I found interesting.
Thank you. And Hala, I don't know if you have the information.
Yeah, I do. We also don't find statistically significant differences by gender in the different categories of the CFIES in this age group and in this population. So they're quite similar in terms of distribution.
Great, thank you. And Mara?
Yeah, thank you. For the adolescents, we had more female respondents than male respondents overall, but we also didn't find a difference in the results between male and female.
Great, thank you. But I think it is important to look at this. For example, I would wonder about India, because people always say that there are lots of sort of inter-household, I forgot the word, but anyway, sensitivities and differences in how food is distributed. Okay, so I think we're coming to the end of our session here. On the consent, I would like to ask everybody to share, if possible, your consent form and sort of the protocol for that. Maybe if you can share it with me and Archana, we can consolidate that and send it and share it with the mixed team. Maybe back to you, Archana, to close off. We can't hear you.
Sorry. Thank you so much. I know there's a lot more that could be discussed, but it's been a really excellent presentation and webinar today, as you can tell by the many comments and discussions that we could, I'm sure, continue with. But I'd like to thank the presenters, but also the audience who has been very forthcoming with their questions and comments, which have been great. The next webinar, we're still trying to finalize the date, but perhaps July 13th. But there is definitely going to be a webinar on bullying and data collection, which will be taking place on July 27th. We had initially set that for earlier. So if you have registered, don't worry, we will just forward it to the new date. So just to let you be aware of that. Again, I want to remind you that the presentations and recording will be available on the SharePoint site internally here at UNICEF, but also on the Mix YouTube channel, which is publicly available. Thank you, Chika, Ed, Hala, Beta, and Mara. And I wish you all a very nice rest of the day. Thank you very much.
Thank you. Bye.
Thank you.
Bye. Bye. Thanks.
Thank you.